part of Chapter 5 references mental illnesses or mental diagnoses that are related to crime. What I want you to understand from the very beginning is a majority of the individuals who have a mental diagnosis or a mental illness do not commit crime, nor are they violent. So please get that straight to begin with. I don't want any stigma coming across from this chapter. But there are particular diagnoses that are more related to crime than others. So let's take a look at those. The first one is going to be antisocial personality disorder. Now, a personality disorder is an enduring pattern of inner experience and behavior that deviates markedly from expectations of an individual's culture. So the pattern is manifested in two or more of the following. So you're going to see these are the avenues that psychologists use when diagnosing an individual. So they're going to have difficulty in cognition, which is ways of perceiving and interpreting self, other people, and events. They're also going to have problems in affectivity, which is the range, intensity, lability, and appropriateness of emotional response. They're going to have difficulty in interpersonal functioning, and they're going to have difficulty in impulse control. So with a personality disorder, this is something that is inflexible. So it is the way an individual interacts with others. So it's inflexible and is pervasive across a broad range of personal and social situations. So it has to lead to clinically significant distress or impairment in social, occupational, or other areas of functioning. That is a personality disorder in general. There are several personality disorders. The one that is most related to crime is antisocial personality disorder. And please do not confuse this with someone who just doesn't want to be social. That is the popular definition of antisocial. That is not what is meant with antisocial personality disorder. Individuals with this personality disorder regularly disregard and violate the rights of others. Their behaviors may be aggressive or destructive, and they may involve breaking laws or rules, or deceit or theft. Now, a personality disorder cannot be diagnosed prior to the age of 17. The idea is that the personality is not fully formed until the age of 17. A unique thing with antisocial personality disorder is that it has a precursor. Even though you cannot diagnose an individual with antisocial personality disorder until they're 17, there is something called conduct disorder, which you can diagnose a child under the age of 17 with, and an individual, in order to be diagnosed with antisocial personality disorder, has to meet the criteria for conduct disorder under the age of 17. I know that gets a little confusing. So, for a personality disorder, like we said, it is impairment in personality, functioning, and the presence of pathological personality traits. So for antisocial personality disorder, their impairments in self-functioning, they have to either are identity or self-direction. So either they are what we call egocentric, which means the world is all about them, or their self-esteem is derived from personal gain, power, or pleasure. Okay, so they feel good only when they are getting power, or they are receiving pleasure, or they are gaining something. There is self-direction, so their goal setting is based on personal gratification. But with this, there's an absence of pro-social internal standards associated with failure to conform to lawful or culturally normative ethical behavior, which means they have goals, but they don't care how they reach them. And this is where crime fits in. They don't care. If they want to be wealthy, they will steal, they will hustle, and I'm not using hustle in a positive way. They have no problem killing someone in order to get what they want. They also have to have impairments in interpersonal functioning. So they can have either A or B. With regards to empathy, and this is typically, it tends to be the hallmark characteristic of antisocial personality disorder, they have a lack of remorse. They actually not only have a lack of remorse, they have a lack of concern for others in general. They don't care about their feelings, their needs, their suffering, and they don't feel bad after they hurt or mistreat someone. Also, intimacy, they have an incapacity for intimate relationships. And when they have them, they usually see them as exploitation of others, and typically their intimate relationships have deceit and coercion. They also use intimate relationships or intimacy as dominance or intimidation to control others. So when they say they love you, it's not that they love you, it's that they love them and they want you because you are fulfilling something that they need. When you stop fulfilling that, they will leave. So you can read this slide, you can pause this and read this slide. This is more, but essentially if you go through and take a look, they actually are very charming. They are dishonest and fraudulent. They, again, lack of concern for or feelings or problems of others, lack of remorse. There can be aggression, there can be sadism, which means that they actually enjoy hurting others. There are persistent, frequent angry feelings. They get very upset over what they perceive as minor slights or insults. They can be very mean and nasty and vengeful. They're irresponsible. They don't pay their bills. They don't really care about them. They don't have any follow through. If they make you a promise, they have no intention of keeping it. They're very impulsive, so they act. Essentially, how I refer to them is they want what they want when they want it, and they typically want it now. So, spur of the moment, they decide what they want. They don't make plans and they don't follow through with plans. And the last that you see, risk taking, they like risk. They take lots of risks. They do not think about the consequences. They don't like to be bored. And remember, they don't care about anyone else around them, so there's a lack of concern for limitations and a denial of the reality of personal danger. They actually think they're kind of bulletproof. So let's talk more specifics. The prevalence, which means how often this occurs, is in only 3% of adults. It's twice as common in men than it is in women. 50 to 80% of prison inmates would qualify to some degree. At least they would have antisocial traits, if not full-blown antisocial personality disorder. The causes are actually unknown, although it is believed to have some genetic factors. Remember when we talked about how people might just be wired differently? Sometimes people just don't have the genetic gene, or they're wired in such a way that they just have no concern for others. And that's what leads to the cause that they believe that child abuse can actually contribute to the onset. As far as treatment goes, antisocial personality disorder is one of the most difficult personality disorders to treat. They don't see anything wrong with their behavior. They're actually getting a lot out of it. They're gaining a lot. They rarely seek treatment. They are right up there with narcissistic personality disorder. Typically, the only time they seek treatment is when they are ordered by the court. The course of the diagnosis is that the symptoms typically peak in late adolescence or early 20s. And then there is some thought that they start to age out in their 40s, which is interesting because if you know anything about crime statistics, most criminals start to age out of crime, which means they stop crime around age 35. So let's talk about, and I know this slide, there's a lot here, but let's just go through it very quickly. The difference between psychopath and sociopath. These terms are a lot of times thrown around in relation to antisocial personality disorder. So a sociopath tends to be nervous and easily agitated, volatile, prone to emotional outbursts, including fits of rage, likely undereducated or uneducated. They tend to live on the fringe of society. They don't have a job or stay in one place for a long period of time. They don't form attachments. To some degree, it's difficult for them. They may be able to, but they have no regard for society in general. They appear to be very disturbed. So when they commit crimes, they tend to be disorganized, spontaneous, haphazard, where psychopaths are completely different. They also are unable to form emotional attachments, and they cannot feel empathy or remorse. Although they can be very charming. They are very manipulative, so they can get people to trust them. The thing with psychopaths is they can learn to mimic emotions. So even though they don't feel them, they actually appear as if they're upset or they are in love. Because some are good at manipulation and mimicry, they actually will enter into relationships. They will have families, but they really don't care about these people. What's interesting about psychopaths, they're often well educated and they hold steady jobs. So when they commit crimes, they actually tend to plan out every detail in advance. They will have contingency plans in place. So they tend to be calm, cool, meticulous. Their crimes are highly organized and generally offer few clues for authorities. Intelligent psychopaths actually make very good white-collar criminals and con artists because they're calm and very charismatic. Now, you can see that there is some similarities with antisocial personality disorder with both a sociopath and a psychopath, but in regards to mental illness or mental diagnosis, neither psychopath or sociopath are diagnoses that are used by psychiatrists and psychologists.